Namaskar दोस्तों, good evening friends. I am Dr. Sanjay Kalra, your friendly and familiar endocrinologist. And you are watching Dr. KK's Med Talks, Pharma Talks with Dr. Sanjay Kalra. आज के हमारे नॉन स्टॉप शो का 869वां 869th एपिसोड है. We've kick-started last month a special series called Pharma Talks, where we invite and speak with guests from our industry, our leaders of the medical and pharmaceutical industry. Let's talk about today's theme. Today is a special day. Today is International Thyroid Awareness Day. Thyroid Awareness Day. It's international, it's global, and so therefore we'll talk about thyroid advocacy. Let's see what our headlines are today. Now, the Indian pharmaceutical industry continues to evolve, continues to improve, to grow, and the consumer affairs industry has said that it will soon issue an advisory to the pharmaceutical sector to stop chemists from compelling consumers to buy a full blister pack of medicine when a smaller quantity can suffice. What they propose is that the medicine packaging can be modified, maybe adding easy-to-remove sections in blister packs marked with perforations, and each section will contain the batch number, the manufacturing date, the expiry date, and other necessary details. This is part of an India for India strategy, where we focus on improving the pharmaceutical sector and as well as its communication with the consumers. The Ministry of Health and Family Welfare has extended the timeline for state governments and union territories to constitute the state-level allied healthcare councils by another 6 months. And our Union Health Minister, Dr. Mansukh Mandavia, has proposed a global medical countermeasure platform with distributed manufacturing and R&D through regional networks and the Global Initiative for Digital Health. With this, let's come back to our topic, which is thyroid advocacy. And a warm welcome to our guest, Mr. Shibu Nair. Warm welcome, Mr. Shibu.
Thank you, sir.
Mr. Shibu, warm welcome to Pharma Talks. You're an esteemed professional known across the country and beyond, more than 2 decades of experience, and currently serving as the General Manager of Marketing and Sales at Intas Women's Health, Ahmedabad. An impeccable track record, and you've been recognized for exceptional contributions, and you've received numerous prestigious awards throughout the career, solidifying your reputation as a leader in the pharmaceutical industry. So warm welcome to the show.
Thank you very much. Extremely delighted to be a part of this show. I've been an avid watcher of this.
We are delighted to have you with us, and Mr. S.P. Srivastav, Swapna Jain Madam from Vellore, Dr. Rameshpal Singh Pawar from Saharanpur, Devasthanam Ji, Ajab Parihar, Vinay Gupta Sahab, and Dr. R.S. Chaudhary. Dr. R.S. Chaudhary is one of the senior most surgeons from Haryana State. All welcoming you.
Thank you so much.
What sparked your interest in thyroid advocacy, Mr. Shibu? What does the thyroid mean to you?
Essentially, sir, it started a way back when I was a brand manager for one of the thyroid brand, and it was in somewhere in 2013 or so. Once when my boss had actually given me this opportunity to take care of that brand, I didn't know anything about thyroid then. It was only that few days of preparation which I had to do to make a presentation to my boss. I had to go through multiple articles, and thanks to you, there are many articles which are written by you. Is something which I take pride in reading and making sure that there's a knowledge, whatever little bit that I have acquired or gathered is by experts like you. And once I was taken care, I was given this opportunity as a brand manager to work on that thyroid brand, mainly the levothyroxine brand. I developed some sort of interest in understanding exactly what this therapy is all about. Honestly, for the last 75 years, there has been no change in the medication. In fact, it's the staple medication has been the levothyroxine for last so many years for hypothyroidism. Then I thought that what is so different in this therapy to really learn. Then, over a period of time, when I was reading many articles written by experts like you, I understood that it's not as simple as it sounds. There is a lot of depth in it, because while medicine has not changed over a period of 75 years, but the treatment has evolved. In fact, in terms of disease and its understanding and its prevalence, and believe you me, India is a hotbed of thyroid disease. So people may say that diabetes, India is a diabetes capital, but many people are still not aware that thyroid actually supersedes that,
Yeah,
and
we
it
seem to have been
becomes
stuck for a minute. But what Mr. Shibu was saying was that India is the hotbed of thyroid disease. And people
absolute.
speak more about diabetes, about obesity, but actually we have a huge thyroid epidemic on our hands. Yeah, welcome back,
Absolute.
Mr. Shibu. Yeah.
Thank you. So, so that was one reason why I developed some interest, and more I read about it. I understood that while there are so much of information, there's enough and more information about the disease in the public domain, that has also led to much of a problem for the patient in terms of who is giving the right information. So I thought, as a healthcare partner with many of the doctors, it's our imperative to give the right information, be authentic information to doctors, and that's the job I am into. That's the reason why I developed a lot of interest in learning more. So I
So
understand that
what
what
we
is
hear from Mr. Nair is that thyroid is important. He's had a long journey with thyroid medication. And another thing we realize is that even though the medicine has remained the same for the past so many decades, our
absolutely.
approach to the syndrome, to the disease has changed. uh, our needs, our expectations have also improved. So people who live with thyroid, they have more expectations of health, which is right. And the doctors who serve them, the healthcare professionals who serve them, they also have more responsibilities and they try to sort of fulfill them. But another point which Mr. Shibu has added is misinformation. Who is providing information about thyroid? Is it the right information? When specialists, people who work only in the thyroid field, do not hesitate in saying that they do not know all the answers to a particular question, or different people with thyroid with the same disease, let us say Hashimoto's thyroiditis, different people will behave differently. They will have different trajectories in life. uh, it is difficult to imagine when this is the case. It is difficult to imagine that people uh, sell or they market a single solution for everybody without any ifs and buts, without any caveats. So that becomes a bit difficult to swallow. There are lots and lots of questions, and from Kolkata we have a comment. Uh, People have taken hypothyroidism very lightly in the past. That is true, and they continue to do so. But there are so many complications. That's right. And if we do something wrong with our thyroid, it can actually bring a cyclone in our stomach. It can actually ruin health overall.
Absolutely.
Uh, okay, this question from Vinay Gupta Sahab. What does LEVO mean? LEVO. Does it mean liver or levothyroxine? So, what does it mean, levothyroxine?
So it's basically the bond, that it's a molecule name per se. It's there, you have the levo and the dextro form of a molecule. So
Dextro.
molecule of thyroid, in which the thyroxine sodium is also called as the levothyroxine. So it's just the name of the molecule, the scientific term being used for that particular therapy, which is thyroxine sodium. Basically, it's a salt, and it's a levo form of the salt, which is not anything else but the levo form of the salt actually.
So there are stereoisomers. Our colleagues in chemistry teach us that you have stereo means shape, isomers means the same molecular formula, but if you put them in the mirror, they'll look differently. So levo means left. So the thyroid hormone, the thyroid molecule is rotated towards the left. You also have a dextrothyroxine, which is rotated towards the right. They are mirror images of each other. And LEVO thyroxine is what we use for therapeutic purposes. But of course, the liver and the thyroid do speak with each other. So people with thyroid disease will often have uh, impairment of liver function. You will find that their liver enzymes like SGOTPT are higher. So thank you, Gupta Saab, for raising this point. Uh, Another comment is I can relate very well to that disease as I have been living with hypothyroidism for the past 17 years. I have brought my medication down also from 225 to 25 microgram. It is difficult, but it is not impossible to balance life. So even with hypothyroidism, you can live a full life. So thank you for that comment. कृष्णा कुमार जी आपसे पूछ रहे हैं, सर मिस्टर शिबू, कैन थायराइड प्रॉब्लम्स लीड टू मूड स्विंग्स एंड डिप्रेशन? डू यू सी दिस कॉमनली इन पीपल whom you speak with?
I have come across many doctors who did mention this. In fact, depression is one of the condition which can happen with thyroid problems. In fact, uh, yes, I think it's a very pertinent question because even many of the doctors overlook that the treatments are mainly done for depression without realizing that the underlying cause could be hypothyroidism. So that's not just about depression. I think Dr. Sanjay can elaborate on that because not just depression, any other disease, there could be an underlying cause which could be thyroid.
So that's true. And this question and comment from Raja Prabhakar ji, from Sriyan Guha, and also from Ali Nazakat Sahab and Chandrasekhar Hari Narayan ji, there can be multiple complications with uncontrolled thyroid. If you control the thyroid, then things are fine. The specific question from Anamika Anuji and also from Sriyan about weight gain, 2 to 3 kg you might gain because of thyroid, but it's just 2 to 3 kg. It's not that thyroid will make you gain 20 or 30 kg. So apart from optimizing our thyroid function, we need to optimize other things as well. Hair fall is certainly a major issue. And Mr. Shibu, would you like to speak about how thyroid impacts our cosmetic health? You know, our hair,
Yeah,
our
I think
nails, our skin, and
absolutely.
how we can use this as a tool to motivate people living with thyroid to take the right medicine.
So, sir, I think very rightly put. While you have many symptoms which are non-specific, basically in thyroid, the symptoms cannot be the reason for treatment all the time. Many doctors have elaborated that in many forum to say that don't just go by the advertisement saying that just because you have a weight gain that means you are suffering from thyroid. Essentially, that's not the cause because symptoms here are completely overlapping with many of the other conditions with the patient. So not necessary that hair fall or a dry skin could relate to only hypothyroidism. There could be other underlying causes. Maybe an expert opinion or going to a doctor and taking a test would essentially tell you that
Yeah,
you are
and
suffering from
Mayuri
hypothyroidism.
Mathur ji asked this question, and the answer is yes, madam. It is possible to have normal thyroid function and still experience the symptoms related to thyroid dysfunction because the symptoms are very non-specific and very common diseases that we have. You know, A for anemia, B for B complex deficiency, C for calcium deficiency, B also for behavior. If you are lazy, if you don't work, if you are physically unconditioned, then you will get all those symptoms. C for calcium and vitamin D, and D for diabetes. So all these common diseases actually sometimes have the same symptoms. D for depression as well. Bimla Kapoor ji, greeting you, Mr. Shibu. And
Thank you.
point is that we become B12 deficient also sometimes with thyroid disease. Let me take this. So, thyroid disease usually in India, 99% of the time will be autoimmune. ऑटोइम्यून का मतलब क्या होता है कि जो हमारी इम्यूनिटी है, जो हम लड़ना चाहते हैं बाहर से किसी आई हुई इन्फेक्शन से, जैसे कोविड से, निमोनिया से, टाइफाइड से, तो हमारे पास बंदूकें हैं, इन्फेंट्री है, कैवलरी है, ये हमारी वाइट ब्लड सेल्स हैं, सब लड़ने निकलती हैं बॉडी में ताकि बाहर वाली इन्फेक्शन को हम हरा सकें। कभी कभी जैसे फुटबॉल में होता है, इन फुटबॉल समटाइम्स यू एंड अप स्कोरिंग एन ओन गोल, तो जोश में आके जो हमारा फुटबॉलर है, ही एंड्स अप स्कोरिंग अ गोल अगेंस्ट हिज ओन टीम। And a warm welcome to Dr. Kamrul Hassan from Bangladesh, one of the senior most endocrinologists of Bangladesh. Warm welcome, Dr. Sahab. And this is International Thyroid Awareness Day that we are celebrating. So thank you for making it international here. So we were speaking about autoimmunity. The body has got defense mechanisms. So just like the army will have cavalry, infantry, the air force, the navy. So we have all different types of white cells which go out and fight infection. Sometimes, however, we end up fighting ourselves. Like in football, you end up scoring a goal against your own team. Or so many times, because of friendly fire, that so-called friendly fire, there are casualties in the war arena. Because of this, sometimes the body begins to fight its own glands and organs. If it fights the thyroid, you end up getting thyroid disease. And if you have an autoimmune disease, chances are you will have more autoimmune diseases. So there is something known as pernicious anemia, where there is vitamin B12 deficiency because vitamin B12 is not absorbed from the gut. So that also is common. Other diseases like vitiligo, फुलवेरी जिसे बोलते हैं हिंदी में, that is common. Then arthritis, जोड़ों की सोजिश, arthralgia, जोड़ों में दर्द, these are also very common. And it's autoimmune. So Vinay Gupta साहब पूछते हैं what triggers thyroid and what are the common ages. So Mr. Shibu, is it more common in women, in men, in young people, in old people? Anything
Sir,
that comes to
the
your mind, sir?
data suggests that while every textbook, every literature talks about, it's a very
Perhaps
common phenomenon.
Mr. Shibu, if you could switch off your camera. Yeah, if you could switch
Yeah,
off your camera, yeah, then maybe the
yeah,
bandwidth will sort of manage.
yeah. So,
Yeah.
am I audible, sir?
Yes, perfect.
So, what I was talking about is that many literatures do suggest that it's a very common phenomena seen in women. Yes, women are at higher risk than men. Nevertheless, men are equally at risk. If you look at the age group, there was a time where people saw that disease more in elderly, but in today's time and age, you will find that the young people are also getting hypothyroid at a very young age. So, if I have to put it plainly, it's a disease from womb to tomb. So, everybody, right from a newborn
From
to
womb to
the
tomb.
elderly, can get that.
Right. Carry on, Shibu sir.
Yeah. So
So
while
usually,
I agree with the fact that
thyroid occurs in women, but it can occur
yes,
in children and in men. बच्चों में, neonates में, नवजात शिशुओं में, you have something called congenital hypothyroidism. So that is when the thyroid gland is not formed or it is abnormal. तो बच्चा जैसे ही पैदा होता है, he or she is born with thyroid. You have to diagnose immediately because otherwise then there can be complications. So Mr. Shibu, you've traveled across the country and I know that you have a strong link and affinity for the Northeast and of course from Kerala where you are from and then from Mumbai and Ahmedabad where you have worked. So it's the entire country that you look after. Uh, have you seen severe cases of hypothyroidism where you will feel sad? You know, we could have helped them with a 1 rupee tablet and we've not been able to.
one of my passion right from beginning has been to one aspect which I've been working very closely was about congenital hypothyroidism you talked about. I think very critical for India, because if you look at the data, almost 1 in 1172 children are at risk of developing congenital hypothyroidism at birth. This is one area where I am really passionate about trying to see that how can we bring in an advocacy in India to have universal screening. Yet many people talk about it, yet that has not been done, and that's one of the preventable cause of mental retardation. I feel that while I have seen a kid with congenital hypothyroidism left untreated and in a severe form, that nothing could be done at that age when it was identified. Had that universal screening been there in India, maybe I'm sure that child would have been a normal child. So that's something which pains me today. We have progressed a lot, but yet we have not been able to get that you know advocacy from the government so far. I'm sure the work is in progress. I am also working closely now in this space. Let's hope that we are able to build in some consensus to get there. Talking about across the country, sir, what I could see that while the diagnostic facilities have improved, so you can see a prevalence rate to be high in south and very well taken in some of the metros. But in rural market, yes, even today, many of the unidentified, undiagnosed patient could be there. That could be one of the area where I'm sure, as a government, as pharmaceutical industry or healthcare practitioners, we can do a lot.
So, thyroid advocacy, here what we are speaking about today's topic, it means we should focus on the rural parts of our country as well, and especially
Yes, sir.
on young children. So, we should screen for congenital hypothyroidism. Kerala is a very good example where actually they have introduced universal screening for newborn children, and they've been able to find a reasonably high rate of children with congenital hypothyroidism. They've been able to treat them as well. One clinical question from Gurvinder Kaur ji. Let me take that. Singh साहब का thyroid profile है T3 157, 1.57 या 157 जो normal है, T4 7.03 ये भी normal है, मगर TSH थोड़ा सा हाई है 6.96। तो इस प्रोफाइल को हम कहेंगे सब क्लिनिकल हाइपोथायरॉयडिज्म। अब जेंटलमैन है, मेल है, एज इज 47, कोई बहुत ज्यादा इम्पैक्ट नहीं पड़ने लगा ऑन हार्मोनल या रिप्रोडक्टिव हेल्थ। यदि लेडी होती, महिला होती, यदि यंगर आदमी होते, अभी मैरिज प्लान करनी है, फैमिली प्लान करनी है, वी वुड आस्क मोर क्वेश्चंस, वी वुड बी मोर एग्रेसिव फॉर ट्रीटमेंट। तो यहाँ पे इन जनरल वील बी स्लो। दूसरा सीजर डिसऑर्डर भी है एंड हाई बीपी भी है, सो वी शुड फोकस ऑन द सीजर डिसऑर्डर एंड द हाई बीपी मैनेजमेंट। थायराइड ट्रीट करें या ना करें, दिस इज अ क्वेश्चन मार्क, एंड सिंस इट इज सब क्लिनिकल हाइपोथायरॉयडिज्म, हाउ विल वी आंसर? जैसे मैं कह रहा हूँ, अगर लेडी होती, यंगर एज के होते, तो हम अपना थ्रेशोल्ड लोअर लगते, जल्दी ट्रीट करते। इस पर्टिकुलर केस में वी विल आस्क फॉर एंटीबॉडीज, एंटी टीजी, एंटी टीपीओ, पूरा फॉर्म एंटी थायरोग्लोबुलिन, एंटी थायरॉयड पेरोक्सीडेज। यदि ये पॉजिटिव आते हैं, एंड दे आर पॉजिटिव इन 20% ऑफ ऑल इंडियन वुमेन एंड रफली 5% ऑफ ऑल इंडियन मेन, यदि ये पॉजिटिव आते हैं, देन वी विल ट्रीट विद थायराइड मेडिकेशन। अगर नेगेटिव आते हैं, देन वी शुड गो स्लो एंड वी कैन रिपीट अगेन आफ्टर अ फ्यू वीक्स। Now, there are many people who say that thyroid is autoimmune, but thyroid autoimmunity के भी triggers होते हैं, and this was a point raised uh, by Vinay Gupta sahab. What are the triggers? So we spoke of childhood congenital, but then other triggers like menstruation, marriage, pregnancy, breastfeeding, menopause, यहाँ पे thyroid जल्दी पकड़ा जाता है। So, Mr. Shibu, since it is a disease that occurs more in women, uh, are celebrities coming out to speak in favor of thyroid advocacy for thyroid management, or are Indian women still shy and they don't want to disclose their own status?
Think things are changing. I think very very pertinent that now a lot of people. There was a time when people used to shy away, not seeking treatment. But then today, thanks to many of them who have come out and they have talked about it. Now, currently, in 2 days' time, we are going to have a celebrity coming and talking about it, not just about the disease per se, but the myths which are associated with thyroid. As we started the program saying that there is a lot of information, wrong information, which is there in the public domain. I'm sure there are influencers which are required to tell them whom to which information to be taken. So I think it is important that the celebrities or the
Now,
advocacy
this point
group.
about influencers, and again, Pratik is with us backstage. Pratik, should Mr. Shibu and I, should we switch off our videos so that the things become better? Shibu is back. Yes.
Yeah.
Dawn is back. So Tiger Ravi
So
Zinda.
I was audible, sir, when I was talking.
Not exactly, but you got a new nickname just now, and that is Thyroid Tiger.
So I was talking about the celebrities' role in here. Yes, we are having some change in the thought process now. A lot of people are now taking up the advocacy, and believe you me, I think in times to come we will be seeing a lot of changes in terms of acceptance for seeking treatment on thyroid, which was not the case a couple of years back. I'm sure you'd agree with that.
So we'll ask Mr. Shibu to share best practices from his company, from Intas, later on. I'll take a clinical question. Madam Pamar is 68 years young, taking 100 micrograms of thyroxine for the past 10 years. Slight depression. Should she continue with the same dose for the whole life? If thyroid is normal at this age, at 68, chances of fluctuation are minimal. But TSH should be done every 3 to 4 months. And if things are fine, then she should continue with the same dose. If TSH goes towards the lower side, then, sir, we should reduce the dose. Maybe from 100, we can bring it to 88. So, Thyroid Tiger, there is a question for you, sir.
Yes.
What is Intas doing specifically? There are two questions, a question and a comment. What is Intas doing um, for the control of thyroid related problems, for expanding awareness? And other companies are busy promoting Zuban Kesri. So how have you been able to use Bollywood as a source of strength for thyroid health?
Essentially, sir, as a pharmaceutical company, we are restricted to talk about our products to consumers directly. But then the area where I am working currently with Intas is that Intas got into the manufacturing of levothyroxine some years back, mainly for the global market. And now we have come to India with the brand which is being launched only a couple of years back. I have set up the complete marketing for thyroid in India, and there's a lot of work which I'm doing with respect to getting influencers to talk about thyroid to patients, and taking experts like you talking about the authentic information. So there are a lot of things which we have initiated. Uh,
Any
Few things.
specific, yeah, any specific examples you would like to share?
So one very important thing about doctor education, because primarily we have only 1,000 odd expert endocrinologists in the country in a population of almost 1.4 billion. So you can understand that not every thyroid patient reaches out to the expert. So one of the area that I'm it's close to my heart is about making sure that how we can disseminate this knowledge from expert to the general physicians, mainly the primary care physicians and gynecologists, who are going to be the first point of contact for the thyroid patient. So one of the area that I have worked would be to get the curated content which would be relevant for the physicians and the gynecologists, so that they need not search the entire Google and find out the information and then go and talk to the patient. So we have great experts like Dr. Sanjay in the country, where who can actually give the right information. So I become a bridge who can channelize this authentic information to the physician. That's one area which I'm very passionate about, and working very closely with Dr. Sanjay and team to do that. That's something which we'll take it to a next level in times to come, because with the digital presence we can have such talks happening across, and maybe involve a larger audience than what we have right now.
There are many questions all overlapping. So let's take this question on diet, asked by many people, including Dr. Kamrul Hassan. Any dietary myths that you have come across during your work? And uh, is a restricted diet, like starving yourself, is that the way towards thyroid management?
I think the question also stems out from the information which is there online. Many of the myths which are there in the minds of common public about thyroid is about the lack of information which exists in the public domain. Some of those information are clearly not something which a doctor would ever advocate. Like for example, they talk about yoga will cure hypothyroidism, while yoga is essentially very good, but does not mean that it is a treatment for hypothyroidism, whereas you got to take medication regularly. That's one thing which very clearly see that people don't want to take medicine lifelong. So once they get their thyroid levels normal, they want to stop the medication. And that's been an area where I thought we should be working very closely to tell the patient that, you should not skip your medicine. And while taking medicine also, you should make sure that you maintain adequate 1 hour gap early morning, empty stomach. That's something very critical for better management of hypothyroidism.
So, dietary restriction, in the sense, a healthy diet is fine. Don't overindulge in calories and sweets. Try to keep your weight down, because, like we see this best practice, if you are able to reduce weight, automatically your requirement of thyroid medication or insulin or any other drug is going to come down. This is usually related to weight. But that doesn't mean that you stop eating chapati or wheat. It also doesn't mean that you stop eating rice. Unless you have an allergy to wheat or rice, then that would be a separate disease. So, wheat allergy is something that is quite common in North India. The further away you are from the equator, so that is the more northwards that you go, the more the chances of autoimmune diseases, and the more the chances of a disease known as celiac disease or gluten allergy. So, if you are diagnosed to have wheat allergy, gluten allergy, or celiac disease, then certainly we have to stop wheat, but not for hypothyroid specifically. Of course, there are things that we must be mindful of. धनिए का पानी, मेथी का पानी, जीरे का पानी. Very commonly used folk medicines for weight loss. The English would be coriander water, fenugreek water, and cumin water. Now, if you take these along with the thyroid medication, it is possible that it doesn't get absorbed properly. So if you're taking any of these, let me repeat again: dhania, methi, jeera, uh, coriander, fenugreek, cumin. If you're taking any of these things, go ahead, but speak with your doctor and take them at least 4 hours apart from the thyroid medication. Similarly, if you're let us say taking a drug for acidity, like a proton pump inhibitor, try to keep it 4 hours away from the thyroid medication, and you'll be fine. And listen to your body. Yes, Seemaji says that the body also gives signals. If I stay happy away from wheat, if I'm happy and healthy, then that's fine. But wheat, you have to replace with something else then. It can be millets or it can be rice. Don't exclude any food group out of all the groups, all the foods that you're eating. And I myself have seen when I travel, I end up eating more salt, which I don't do at home. I end up eating more carbohydrate because I'm vegetarian. So that's when you're traveling, you don't have a choice. So you eat whatever you are given. And I do tend to retain fluid. I end up gaining a kg or two of weight, which disappears when I come back home. Sir, more question. You've talked about yoga being a good lifestyle, a healthy lifestyle, but it is an adjuvant for thyroid medication. रिद्धि देसाई जी पूछती हैं, any specific exercises or physical activities that can help support thyroid function? And in your work for thyroid advocacy, have you also been talking about active lifestyle, physical activity?
Absolutely, and that's something essential, Dr. Sanjay, for everything, whether it is a diabetes or a hypothyroid. Uh, as you rightly said, that hypothyroidism and weight gain is closely associated, but people understand that this weight gain is not controlled only by medication, because with the medication you might reduce a 2 or 3 kgs, whatever, slightly, because of the fluid retention in the body. Whereas the active lifestyle is essentially important for not just thyroid, for any other disease which the patient is encountering. Thyroid is also not excluded from there. I'm sure this doesn't require any advocacy for that matter, because I think healthy lifestyle brings in the healthy mind. So I would suggest that a healthy lifestyle would always be preferred.
And just like you have rehabilitation, physical rehabilitation after heart attack, now for the person who has been living with uncontrolled hypothyroid for a long time, it is slightly more difficult to go to the gym to begin exercising. So you just do it in a graded manner, go slow, and every week you keep on increasing the intensity or the duration of your exercise. And finally, you will be able to exercise as much as the person next to you. Mr. Shibu, Dr. Vipin Bandula is with us. Sir is civil surgeon from Kangra in Himachal.
Hi, sir.
Now,
Hi, sir.
Kangra has a very important role to play in thyroid awareness, and because today is International Thyroid Awareness Day, let's spend a minute talking about this. तो बहुत साल पहले अराउंड कितने साल हो गए 60 साल हो गए 60 साल पहले स्टडी की गई कांगड़ा वैली में उस टाइम पे ये पंजाब प्रांत का हिस्सा था और उन्होंने पहली बार क्या किया कि उन्होंने एक गांव में आयोडाइज सॉल्ट दिया दूसरे गांव में नॉन आयोडाइज सॉल्ट दिया सो दे गिव आयोडाइज सॉल्ट टू द inhabitants of one village and non-iodized or the normal rock salt to other inhabitants, other villages in the same valley. And what they found out was that just iodizing salt is able to eradicate goiter. It is able to eradicate iodine deficiency disorders. And finally, our IQ improved. बच्चों का IQ बढ़ गया. Because of the Kangra Valley study, which is famous across the world, Indian government ने mandatory कर दिया that all salt should be iodized. एंड अब प्रॉब्लम क्या है कि जो लोग सेल्फ स्टाइल्ड इन्फ्लुएंसर्स हैं उन्होंने कांगड़ा वैली में जाके कभी देखा नहीं कि उससे पहले कितना ग्वाइटर था कितना आयोडीन डेफिशिएंसी था उन्होंने कभी आयोडीन डेफिशिएंट वाले कम बुद्धि वाले बच्चे नहीं देखे दे हैव नॉट सीन मेंटली चैलेंज्ड चिल्ड्रन हु आर चैलेंज्ड बिकॉज ऑफ आयोडीन डेफिशिएंसी एंड दे टॉक ऑफ सेंधा नमक व्हिच इज फाइन बट एज एन एडजुवेंट इफ यू डोंट टेक आयोडीन then you will get iodine deficiency. If you happen to live on the seashore in Kerala or Tamil Nadu and you happen to eat only sea fish for breakfast, lunch, dinner, तो iodine deficiency नहीं होगी. But for the rest of the Indian subcontinent, you will become iodine deficient because और कोई source नहीं है. If you come to Haryana or Himachal or Uttarakhand, हमारी जमीन में हमारी soil में iodine या selenium नहीं है. So we don't even get that from our cereals. So we are thankful to the Kangra Valley and to Dr. Bandula for having created health for the country. Sir
Really.
पूछते हैं about hypothyroidism and methionine metabolism. So I am aware of animal studies, sir, where methionine restriction is able to help improve thyroid function. But whether this has converted uh, into meaningful medication for human beings, that I am not sure. I don't think so. Maybe this would be work for Mr. Nair and his colleagues to focus on this and to do some new research for us. Methionine restriction and thyroid function. So we've answered the question by Naina Agarwalji, who has been talking about thyroid and diet. And Seema ji bolti hain, I eat millets, rice and barley, which is fine. So some people will like rice, others will like millets or barley, and yet others will want wheat. And she's managed to reduce 20 kg. Aare Seema ji, hamare sar pe bhi haath pher do. And wrap up dinner by 7:30, which is the right thing. Okay, and a good point which we missed out. Mr. Shibu, any comments about soya bean? Soya bean in general, soya bean at breakfast, soya bean and thyroid.
So I'm sure, sir, whatever I've heard about this from various experts, soya does play a role in thyroxine absorption. But then, to an extent that if you completely replace your meal with soya, then yes, it could interfere. But just the proportion that you take along with a meal, I don't see that as a problem, whatever the data suggests, because if you replace the complete meal only with soya, then the case would be different. But yes, you if you're taking a thyroid medication, you need to avoid soya products, maybe at least for 4 hours from the time that you are taking a levothyroxine in the morning. So this is what the data I have read. I'm sure you can throw more light on this.
Dr. Bandula points out that soya bean is a goitrogen, which means it increases goiter. And जिन कंट्रीज में सोयाबीन स्टेपल फूड है, लाइक इन साउथ ईस्ट एशिया, सोया मिल्क, सोयाबीन टोफू, तो वहां पे डॉक्टर ज्यादा प्रोएक्टिव होते हैं इन टेलिंग देम टू रिड्यूस द intake of soybean. In India, the intake is not too much, and if you avoid it at breakfast, you are fine. If you don't drink soya milk at breakfast, you are fine. So very few of us would do that even normally. Same for turnip और शलगम. तो शलगम भी जो है कुछ एक कंट्रीज में, जैसे बल्गेरिया में इट इज अ स्टेपल फूड. तो टर्निप इज ऑल्सो अ goitrogen. Cabbage also is a goitrogen. If you take too much of cabbage or turnip and आप सुबह दोपहर शाम वही खाते हैं, the way we eat potatoes, for example, in India, or the way we eat rice or wheat, then there might be a problem, but not in the quantity that otherwise we would use. Dr. Bandula also mentions that he used to see so many mentally retarded children and adults 30 years ago in the hilly areas, but nowadays it's very rare, and this is thanks to iodized salt. And thanks to everybody for joining this, movement towards a healthier country. Seema ji point out करती हैं that fermented soya is better. That's right. And from Northeast India, we have been speaking that Northeast India is the home of so many good practices, like fermented food, for example. So, Mr. Shibu, which is your favorite fermented food from Assam or the rest of the Northeast? Something that you
Sir,
would dive on.
I'm sure they take a lot of cheese with their meal, and being a cold place, cheese and a kind of local Tibetan food which has this fermented cheese which they keep on eating
Yeah.
with all the food. But maybe a good idea for a Northeast, but may not be a good idea for people who live in Ahmedabad.
सीमा जी is an expert and she has this wonderful website. तो सीमा जी आप हमें सिखाएं ना how to make आलू पितिका and how to make fish पितिका. So simple ways of fermenting. Fermentation का फायदा ये होता है, जैसे जब आप दही बनाते हैं या डोसा या इडली का बैटर बनाते हैं, that is also fermentation. Fermentation का फायदा ये है कि it gives good food to the bacteria in your intestine. तो जो हमारे बैक्टीरिया है इंटेस्टाइन में, उनको हम बोलते हैं प्रोबायोटिक. जो उनका खाना होता है उसे हम कहते हैं प्रीबायोटिक. सो जो फर्मेंटेड फूड है दैट इज प्रीबायोटिक. इट इज फूड फॉर द बैक्टीरिया. अब ये जो बैक्टीरिया है इन द intestine, they are a very good source of help for us. They are called our second endocrine system. वो endocrine hormones बनाते हैं. They are called our second nervous system. वो मैसेजेस भी भेजते हैं. जब आप बोलते हो ना कि मेरे पेट में गुदगुदी हो रही है, मेरे पेट में चूहे दौड़ रहे हैं, there are butterflies in my stomach. It is actually those bacteria which are creating that butterfly effect. They are also known as the second genetic system of the body, क्योंकि इतना सारा DNA है वहाँ पे. तो जब हम इनको ठीक खुराक देते हैं, which is fermented foods, right? So then they become happy. And there is something known as microbiome diversity. जितने ज्यादा तरह के बैक्टीरिया होंगे आपके गट में, उतना ही आप ज्यादा मेटाबॉलिकली हेल्दी होंगे. सो सीमा जी, रिक्वेस्ट टू यू इज fermented foods, cuisines from Kashmir, which is your home, and cuisines from Eastern India, which is your home now, your adopted home. And she also points out fermented millets called ambali is a superfood for B12. Yes. So maybe we can speak about fermentation and culinary medicine later on. Dr. Vipin बात करते हैं of thyroid and vascular health. So, Mr. Shibu, when you speak with doctors, do they speak only about children, about women, about mood, but or do they also speak about blood pressure, heart disease, angina,
I think
cholesterol?
now if you look at the data which IQVIA throws out in terms of prescriptions, I saw a lot of cardiologists using levothyroxine today. So which clearly tells you, when I met many of the cardiologists, they say that this is a very common thing that we use. I never knew that this has been seen as one of the major problem in their patients with high blood pressure. So today, the awareness level among the primary care physicians to seek for thyroid status even before starting a treatment for maybe blood pressure or any hypertension medication has started. I won't say that it's happening across the country, but yes, what you're saying is right, because there is still a lot of connection between high blood pressure and thyroid, and there are a lot of patients who are reporting it.
So everybody with high blood pressure, with high cholesterol, and with heart failure, you must do a TSH. You must screen for thyroid. Until you optimize the thyroid, you will not get proper benefits from your blood pressure, cholesterol, or heart failure medication. Also, those with heart attack, with angina, unstable angina, we have to be mindful that we should not overtreat the thyroid. So we should remain within limits. And ऐसे ही क्वेश्चन आ रहा है रेनू जैन जी का. मैडम जैन का T3 T4 ओके है, TSH इज 8, ये हाई है, विच मीन्स यू हैव सब क्लिनिकल हाइपोथायरॉयडिज्म. सब क्लिनिकल. अगर T3 T4 लो होते तो हम तुरंत दवाई शुरू कर देते. अब जो आपका क्वेश्चन है, डू आई नीड मेडिकेशन, इसके लिए हमें आंसर देना पड़ेगा. सो इफ यू आर यंगर, यू आर स्टिल प्लानिंग अ फैमिली, कोई भी गायनी की दिक्कत है, वी विल स्टार्ट ट्रीटमेंट. यदि आप एज में थोड़े से इवॉल्व हैं, लाइक डॉक्टर पवार सर एंड मिस्टर शिबू इज ऑन द राइट साइड ऑफ 50, या मेरी तरह हैं, देन मे बी वी विल नॉट ट्रीट, मे बी. और चीजें, अगर आपकी एंटीबॉडीज पॉजिटिव हैं, एंटी टीजी, एंटी टीपीओ, या फैमिली हिस्ट्री पॉजिटिव है, आपकी सिस्टर, आपके मम्मी या आपकी बेटी को किसी को थायराइड है, देन वी विल ट्रीट इमीडिएटली. इट इज ऑटो इम्यून. अगर फैमिली हिस्ट्री नहीं है, वी माइट वेट एंड वॉच. एंड देन सरोगेट मार्कर्स, अगर आपका कोलेस्ट्रॉल, ब्लड प्रेशर, लिवर एंजाइम्स नॉर्मल है, वी विल वेट एंड वॉच. मगर यदि कोलेस्ट्रॉल, ब्लड प्रेशर, हार्ट की बीमारी, ऐसी कोई दिक्कत है, लिवर की बीमारी है, तो फिर हम जल्दी ट्रीट कर देंगे, बिकॉज वी वांट टू ऑप्टिमाइज द टीएसएच सो दैट वी कैन गेट बेटर आउटकम्स. एंड सीमा जी बोलती हैं, इन कश्मीर द ओनली फर्मेंटेड फूड वी ईट इज योगर्ट, व्हिच इज फाइन. सो एक पाव पेरुगु कम्स फ्रॉम तेलुगु. दैट्स द एंटायर तेलुगु दैट आई नो. So एक पाव पेरुगु means 250 grams of curd. That is the best treatment, and it keeps your gut happy. Homemade pickles, she reminds us, Seema ji reminds us, are also fermented food. So you can pickle, your mango season is there now at home. So we'll do that at home. Okay. Sir, a question for you from Rinki Goldie ji. Hypothyroid patient क्या animal food खा सकते हैं? Can we eat meat and mutton and chicken and fish?
So this question is to me.
Yep.
Food, whatever data is available, there is no restriction for thyroid and food, essentially, except for the fact that you told about those soya and other goitrogens which are there. But otherwise, essentially, and that's also a myth which exists in the mind, that once you have hypothyroid, then you should have a lot of restrictions in food. Absolutely not. People can have a normal food. Only thing is, when they are taking medication, you need to be careful that you should not be eating anything for 1 hour from the time you're taking the medication.
एंड ग्लूटेन एंड डेयरी यू कैन टेक, रिंकी जी, अनलेस किसी को ग्लूटेन एलर्जी है या डेयरी एलर्जी है, कुछ एक लोग होते हैं। डेयरी एलर्जी भी एलर्जी नहीं होती, बट जो मिल्क हजम करने के जो एंजाइम्स हैं, द एंजाइम्स विच डाइजेस्ट मिल्क, दे कीप ऑन रिड्यूसिंग विद एज. So above the age of 13 or 15, these enzymes begin to go down. So a 50 or 60-year-old person will not be able to digest milk as properly as an 8-year-old boy. However, अगर आप ऐसे ethnic group से आते हैं, let's say Haryana, where our average intake would be 1 liter of milk a day, milk or milk products. So I think those enzymes remain active till old age. But if you're not used to eating dairy products or drinking milk, then you might get in trouble. यदि ऐसा कुछ है, then you shift to yogurt for a short period of time, so you get your gut acclimatized to yogurt, which is a fermented food. And this question which I ask many people in my OPD, especially the young boys and girls, 1 किलो दूध से कितनी दही बनती है? So this is a question for everybody. From 1 kg or 1 liter of milk. Now I hope I don't get trolled politically between 1 kg and 1 liter of milk. So let's be safe. 1 liter of milk will give you how much of yogurt? So that's a question for everybody, and we can ask this question to people who visit us in the clinic. Dr. Bandula, this quiz is not open to you, Thyroid Tiger. डॉक्टर विपिन बंडूला भी हमारे थायराइड टाइगर हैं, तो सर बोलते हैं दैट थायराइड प्रिपरेशन वाज गिवन अर्लियर टू पेशेंट्स विद इनफर्टिलिटी. टू बी ऑनेस्ट सर, आई स्टिल डू इट. एंड द रीजन इज दैट if you have a lady who is planning pregnancy or who is antenatal, then you want to keep the TSH low, between 0.1 and 2.5. तो अगर 2.8, 4, 4.3 भी है TSH, तो भी हम दवाई दे देते हैं. What this does, the lower TSH, it optimizes the milieu or the environment around the ovum, and the egg is able to behave in a healthier manner. तो pregnancy जल्दी होती है. So that is why the thyroid preparations were given earlier, and we do continue to use that. It's old-fashioned medication, but it works. Swapna Jain ji Vellore से share करती हैं best practice. In South India, the most common breakfast is idli, dosa, ragi koos mixed with curd, cooked rice soaked in water overnight, and consumed in the morning for breakfast. And all these are fermented foods. And Seema ji, actually enlightenment तो आप करते हैं, तो all these things about cooking, but let's tease our thyroid tiger now, and let's ask him, Mr. Nair, we have this question for you. So you know this issue about whether the milk from Karnataka is tastier than the milk from Kerala or not. So our question is, fermented foods from Kerala, Karnataka, and Tamil Nadu, what's the tastiest? Which is your favorite cuisine?
Sir, I am a loyal Keralite, so idli dosa is something which nobody would. I think this is a global food now, no longer a South Indian or a state-specific food.
Yeah,
But yes, it has the essential component of protein and carbohydrate in the right proportion. So, which all healthy diet would want to have. I think this is a perfect fit. Our great grandfathers and all have actually lived with this for more than 100 years. So you can understand that this is one diet which I'm sure does not have much of oil and other thing. It's all steam cooked and fermented. I think there cannot be a better diet than idli dosa.
Idli is actually steamed. Yeah, we must remember that as well, and it's quite healthy. My favorite, of course, from Malayali cuisine is something that is quite unhealthy, and that is fried plantains. So I'll be traveling to Kochi tomorrow to celebrate Thyroid Awareness Week, and I am looking forward to eating the plantains, which is something we don't get in Haryana. That is my favorite. डॉक्टर विपिन पॉइंट आउट करते हैं, प्राइमरी हाइपोथायरॉइडिज्म अलग होता है, विच इज 90-95% ऑफ ऑल आवर पेशेंट्स. प्राइमरी थायराइड मींस आपका थायराइड ग्लैंड वीक हो जाता है. सेकेंडरी हाइपोथायराइड, दिस इज क्वाइट रेयर, बट इट इज, यू डू पिक इट अप, एंड इसमें पिट्यूटरी ग्लैंड या हाइपोथैलेमस, पिट्यूटरी इज द मास्टर ग्लैंड इन द ब्रेन, ये वीक हो जाता है, तो ये कम काम करता है. Because it doesn't work, the thyroid gland also becomes a bit lazy. And in secondary hypothyroidism, you always have to check the T3, T4, and TSH. All will be low. There is a disease that is that used to be very common. It has become less common now, mercifully. It's called Sheehan syndrome, and you will still find it in parts of the country जहाँ पे healthcare बहुत अच्छी नहीं है, women's care अच्छी नहीं है. तो delivery के time पे, at the time of delivery, when the mother is delivering her baby, अगर बहुत ज़्यादा bleeding हो जाए, so this is called APH, antepartum hemorrhage, या PPH, postpartum hemorrhage. Bleeding बहुत होती है, तो brain को blood कम मिलता है. In the brain, there is a pituitary gland, बहुत छोटा सा gland है. Pituitary gland is highly dependent on blood for its health. तो जब ये blood निकल जाता है, pituitary gland कमजोर हो जाता है, उसको blood नहीं मिलता. There is pituitary necrosis, and that causes a disease known as Sheehan syndrome, which includes secondary hypothyroidism. रेनू जैन जी 59 ईयर्स यंग हैं, तो आई थिंक मैडम अगर TSH 8 है तो ऐसे ही चलने देंगे इफ यू आर कंफर्टेबल, अनलेस यू हैव एनी लिमिटेशंस. कोई तकलीफ है, कोई सिम्टम्स हैं, कोई हार्ट या लिवर की डिजीज है, फिर दवाई देंगे. मेनी अदर बेस्ट प्रैक्टिसेस. आपको भूख लगनी शुरू हो जाएगी. डॉक्टर बंडूला बोलते हैं सी फूड इज गुड ऑल द वे फ्रॉम हिमाचल एंड एक्चुअली इट इज रिच इन आयोडीन. दैट्स राइट. सो डॉक्टर मिस्टर शिवू, योर फेवरेट सी फूड?
I was a vegetarian for a long time, but in the last couple of years, I have started taking fish. So fish is, being a Keralite, nobody would miss out on fish. That is my favorite, so nothing else. Otherwise, I prefer more of a vegetarian diet.
And Seema ji and Dr. Kamrul are from Bengal, so they say, and Dr. Kamrul is from Bangladesh, so for them the favorite is Ilish, Hilsa fish.
Ilish, yes.
And now we can have another debate upon whether the West Bengal Ilish or the Bangladesh Ilish is tastier. So let's see what answers we get for that. Seema ji raising other points. So panta bhat, which is a fermented rice, which is very good for the gut. It keeps the bacteria in the gut happy. So what people do to save their rice from getting spoiled, they just keep the rice in water so that mosquitoes and insects are not able to access it. And there is a slight fermentation that occurs, but the nutrition value is preserved. So this panta bhat is something that you can try. Listen to your own body. So non-veg is difficult to digest if you take it later on at night. So take more at lunchtime, and just listen to your body and follow what the body says. Dr. VK Goyal asks, can we take thyroid medications along with BP medications in the morning? So, Mr. Shibu, your take on this?
Like I just mentioned in the earlier talk also, that whenever you're taking any medication, not just for BP, any medication, the guideline is that you need to maintain at least 4 hours interval between a thyroid tablet and any other medication. Essentially, BP medication needs to be taken at a regular interval. So similarly, thyroid medication. So the one of the advice that even Dr. Sanjay has given in many of his talks is that you first get up in the morning, take thyroid tablet, take with a glass of water and go to sleep, maybe at around 5 o'clock or something, and then wait for next 3 to 4 hours and then take any other food or medication or anything. So if you're taking a tea or a coffee, you maintain at least a 1 hour gap. But if you're taking any other medication, a 4 hour gap would be essential for better absorption of levothyroxine.
And these things are important. Sometimes we end up blaming the medication or we end up blaming the doctor कि जी उन्होंने मेरा इलाज ठीक नहीं किया, इसलिए 100 के बदले 125 मुझे गोली खानी पड़ेगी या 150 करनी पड़ेगी, जी कंपनी वाले खराब हैं. Actually, it's about how we take and when we take the medicine. So if we follow these rules, the absorption is better and you actually need less medication. So it's just about a little bit of self-discipline. Dr. Bandula points out that milk allergy is always less with milk of indigenous breeds. तो एक A1A2 मिल्क हाइपोथेसिस है. A1A2 मिल्क हाइपोथेसिस. A1 मिल्क जो है, that is the protein that is present in western cows, जो तकरीबन पूरे इंडिया में भी वो यूज होती है. HF cows are what we rear. A2 is the milk protein that comes from the milk of indigenous cows like zebu cow, and these are a fast vanishing breed. जो buffalo है, which is our mainstay of the dairy industry in Haryana and Punjab, that is A1 A2. It is a mix of A1 and A2. तो यदि आप A2 milk लेते हैं, which is indigenous cow milk, which is difficult to get, then the allergy chances are less. This is especially true for neonates, जिनका GIT well developed नहीं होता. For a preterm baby, a baby who is 1 or 2 or 3 months, वैसे तो mother feed होना चाहिए. पर यदि आप cow milk दे रहे हैं, तो A2 is safer. Buffalo will come in the middle, A1, A2, and the western cow, HF cow wala, A1, that is most antigenic. Dr. Pawar has a question. Sambar bada. What's the status of sambar bada from a fermented food point of view and a thyroid point of view?
Food has got absolutely nothing to do with thyroid per se, but sambar and vada. since it is a fried item, so I'm sure one has to take in moderate proportion. It will be okay. Otherwise, I don't see any problem as such with both of these.
Moderation would be the key, I think. And सांबर में चीनी ना डालें sir, which some people are fond of. रिंकी जी, अगर एंटीबॉडीज पॉजिटिव हैं मोर देन लेस देन 1300, तो दैट इज, वो आपकी फितरत है, दैट इज द वे यू आर मेड. इट मींस यू आर predisposed to autoimmune disease, and the diagnosis is yes, it is Hashimoto's thyroiditis. There will be no medication that will be able to reduce this, but ये अप डाउन होता रहता है लाइफ में. इसके ट्रिगर्स ढूंढना बहुत मुश्किल है. फॉलो अ बैलेंस्ड डाइट एंड ट्राई टू अवॉइड स्ट्रेस, एंड इट विल रिमेन अंडर कंट्रोल. बट ये गायब नहीं होंगी एंटी टीपीओ. यू हैव गॉट इट ईदर फ्रॉम ईदर ऑफ योर पेरेंट्स, मोस्ट प्रॉब्ली फ्रॉम योर मदर. कभी कभी लोग बोलते हैं जी मेरे मम्मी पापा को नहीं है, तो डीनोवो म्यूटेशन भी हो सकती है, इट कैन हैपन इन एनीबॉडी. बट फिर उनको कहेंगे कि अपनी बुआ की, मासी की, बुआ की बेटियां, मासी की बेटियां, उनके भी टेस्ट करवाएं. कहीं ना कहीं आपको फैमिली ट्री में पॉजिटिव एंटीबॉडी जरूर मिलेंगे. Calcium, yes, is governed by the thyroid gland, and if you have hypothyroid, then you are at greater risk of developing thyroid disease. Not only thyroid disease but bone disease, so we have to supplement with calcium and vitamin D. Curd
Dr.
rice is yeah, Manjula Rani Sahaji says curd rice is the best prebiotic. So Mr. Shibu, your opinion on the best curd rice in the world, कहाँ पे मिलता है?
सर मैं तो खाता नहीं हूँ कर्ड, बट आई थिंक तमिलनाडु पीपल आर वेरी फॉन्ड ऑफ कर्ड राइस, सो आई कैन ओनली अंडरस्टैंड दैट तमिलनाडु इज द प्लेस वेयर anybody who is from Chennai in our teams also, they don't want anything else but curd rice. So that
And
could
I
be
fully
one.
agree with them. Yeah, though I would want to add the plantains, of course, next to the next plate. But curd rice best you will get from Tamil Nadu. There I agree with sir.
Sir,
Secondary amenorrhea.
one thing,
Yeah.
Dr. Sanjay, I wanted to actually add one more thing, and this is something which I've come across from many doctors, especially from the gynecologist. And this has been a question which has been not answered in many of the forums as well. That thyroid antibody treated with steroid. What's your opinion on that, sir?
Not a good idea. It doesn't make any sense at all.
Correct.
There is no role of steroids in hypothyroid or hyperthyroidism. There is a role in subacute thyroiditis. वो एक वायरल इन्फेक्शन है. Subacute thyroiditis में बनता है स्टेरॉइड देना for short period of time, but then the diagnosis should be made. Subacute thyroiditis, उसमें बहुत दर्द होगी. You will have such severe pain in the neck. You will have to go to the doctor immediately. It's 8 o'clock and we'll just take last comment. Swapna Janji, yes, we agree with your favorite food, which is Tamil Nadu vegetarian food. Actually, too good. We'll come to Vellore someday to taste it. And Seema ji का जो comment है, balanced diet, stay well, stay stress free, dance it out and laugh it out. मस्त रहो, तो स्वस्थ रहोगे. Compliments and blessings for you, Mr. Nair from Karnal, from Dr. R.S. Chaudhary, sir. He says an excellent talk and I have learnt a lot from you. And thank you for all your efforts towards thyroid advocacy.
Thanks for giving me an opportunity to be a part of this, sir. Thanks a lot. Thank you,
We have with
everyone.
us Pratik, who is backstage. Pratik, could you please show a certificate of appreciation for Mr. Nair, please? Thank you, Mr. Nair,
Thank you,
for
sir.
being with us. Thank you. It's been great being with you, sir, and thanks to everybody for being with us. KK Med Talks is a daily show, and मैं आपका होस्ट होता हूँ हर सोमवार और हर वीरवार. तो सोमवार हम अब मेड टॉक्स करते हैं और वीरवार को फार्मा टॉक्स. एंड इस सब के साथ आपसे इजाज़त लेते हैं. हमारे साथ जुड़े रहें, मिलते रहें. शुक्रिया. जय हिंद.
Thank you so much. Thanks, everyone.